Your upcoming transition to an EMR will be an expensive and time-consuming process, and you'll want to do everything possible to ensure its success. Healthcare providers who've made the move to EMR have one frequent complaint: the amount of additional time required to generate clinical documentation. In fact, generating clinical documentation via an EMR can take some providers as much as 3 times as long when compared to their normal workflow of dictating patient encounters. Some healthcare facilities adapt to the increased clinical documentation demands of an EMR by hiring additional staff who join the physician for each patient encounter just for the purpose of generating the clinical documentation via the EMR. So, whether the increased workload is absorbed by the healthcare provider or results in the need for additional staff, EMRs can be a more time-consuming and a more expensive method of generating clinical documentation. This is a key reason for resistance among many healthcare providers to adopting EMRs. That's where WebChartMD can help. As you move towards your EMR implementation, WebChartMD can improve the success rate of EMR adoption by your healthcare providers by reducing the time and the soft cost expense in generating clinical documentation. Here's how it works. Dictation is captured via handheld digital recording devices or telephone and uploaded into the WebChartMD workflow. From there, WebChartMD's audio file management provides a variety of different routing options and allows files to route to either your external or internal transcription resource or a combination of both. Or choose from our network of almost 100 US-based companies that specialize in clinical documentation. Once routed, audio files are delivered to medical language specialists for transcription directly into your EMR, or routed into the WebChartMD workflow for transcription and delivery via a secure interface into your EMR. For some healthcare facilities, WebChartMD's powerful document management tools provide workflow efficiencies that prompt healthcare providers to manage most of their document workflow right in WebChartMD. From there, the finalized note is interfaced into your EMR. WebChartMD's proprietary interface engine was developed in-house and is used to generate inbound and outbound HL7 and non-HL7 interfaces into virtually any EMR system in use. For those healthcare providers who do wish to manage some part of their clinical document review via WebChartMD, the workflow looks like this. Providers log into WebChartMD and are taken into their online account. The folder pane to the left tracks the progress of clinical documentation through the workflow. The pending folder, seen here to the left, holds dictations that have been uploaded and are waiting to be transcribed. Once the document is generated, the audio file travels with the completed document from the pending folder into the inbox. It's from the inbox view that documents are processed. There are 2 common workflows. One where providers review and e-sign documents electronically in their online account. The system also has the capability of allowing providers to review notes from hard copies should that need ever arise. In those cases, support staff highlight the documents to be printed and click the Print button in the toolbar. Documents are printed and reviewed on hard copy by the provider. If changes need to be made, support staff with edit permission can open the document and make the necessary corrections. User access to documents is controlled by 16 different permission levels. If the change is something the staff person is unable to make, they can press the Reject button in the toolbar and route the note back to the transcription resource with comments. The more typical workflow is where providers review and edit notes within WebChartMD prior to the notes interfacing into the EMR. Here's what that looks like. Providers highlight the documents to be opened and press the Open button in the toolbar. Documents open in Microsoft Word and present on screen. Because the providers are working in Word, there are no new systems to learn. Once the documents are open, the provider moves through the stack of documents by clicking the X in the top right corner of Word to close the current document and move to the next one. After reviewing documents and making any necessary edits, the provider is returned to the WebChartMD inbox view. From there, he or she presses the e-sign button in the toolbar to batch e-sign all highlighted documents en masse. Upon being e-signed, a number of helpful workflow triggers occur. Documents are automatically faxed out to any primary and secondary CC'd recipients. Documents are automatically printed, if desired, to any designated printer. Documents move from the inbox to the final folder, where they're kept in permanent archive. And then lastly, documents are interfaced into the EMR. 3 interface triggers are possible: when documents first hit the inbox, or when they're finalized by one of the staff, or when they're e-signed by one of the providers. That's how easy it is. WebChartMD can improve the success rate of your EMR implementation by reducing the time and soft cost expense in generating clinical documentation. To see the full demo, please contact us at 877-858-6677, extension 1 for sales, or sales@webchartmd.com.